What if your doctor's orders are actually hurting you? Imagine this. You walk into your doctor's office for a routine checkup, like you've done for years. You feel fine. No pain, no complaints. But then, your doctor orders a few tests, just in case. Weeks later, you're taking new medications, facing anxiety-inducing results, or even considering an invasive biopsy, all for something that might never have hurt you. Sounds familiar? If you're over 70, this scenario might not be helping you at all. It could be hurting you. In today's video, we're exposing 5 common health checkups that many seniors are told to do, but the latest research says they may do more harm than good. Before you panic, no, we're not telling you to ignore your health. But when you're older, preventive care sometimes needs a second opinion. Stick around to the end. The last checkup might surprise you the most. Let's dive in. Section 1. PSA tests, the prostate screening that can backfire. If you're a man over 70, chances are you've heard of the PSA test, prostate-specific antigen. It's a blood test meant to detect early signs of prostate cancer. Sounds important, right? Well, not so fast. Here's the problem. PSA levels can rise for many reasons that have nothing to do with cancer. And in men over 70, most prostate cancers grow so slowly that they will never become life-threatening. In fact, many seniors will die with prostate cancer, not from it. But when PSA results show elevated levels, it often leads to unnecessary biopsies, which can be painful and lead to infection, radiation or surgery, which can cause incontinence or impotence, anxiety over a condition that may never progress. A 2023 study in JAMA found that men over 70 who had routine PSA screenings were more likely to experience complications than benefit from early detection. What to do instead? Ask your doctor, how would this test change my treatment plan? What are the chances this cancer would actually affect me? In most cases, unless you're having troubling urinary symptoms or have a strong family history, skipping the PSA test after 70 is not only okay, it's often recommended. Section 2. Tight blood sugar control, when perfect becomes dangerous. If you have type 2 diabetes, you've probably been told to keep your blood sugar low. That advice works well for younger people, but in your 70s, it could be dangerous. Here's why. The older you get, the more sensitive your body becomes to low blood sugar, also known as hypoglycemia. Hypoglycemia can cause confusion, dizziness, fainting, and even falls. Seniors are more likely to be taking multiple medications, which can increase risks of insulin mishaps. Tightly managing your A1C below 6.5 might look good on paper, but studies show that moderate control, an A1C of 7.5 to 8.5, is much safer for older adults. The American Diabetes Association now recommends individualized targets for seniors, especially those with other chronic conditions or cognitive decline. What should you do instead? Have regular conversations with your doctor about your goals and risks. Ask, is this level of control necessary for me? If you're prone to lightheadedness or falls, your sugar may be too well controlled. Sometimes, good enough is the healthiest choice. Section 3. Overtreating high blood pressure when lower isn't better. It's drilled into us, high blood pressure equals bad. So naturally, doctors aim for low readings. But here's where that gets risky. For people over 70, overly aggressive blood pressure management can lead to falls due to dizziness when standing, orthostatic hypotension, fatigue or weakness, reduced blood flow to the brain, increasing risk of cognitive decline. While guidelines suggest 120/80 as ideal, For seniors, a target of 130 to 150 systolic might actually be safer, especially if you're otherwise healthy and active. A large NIH study, SPRINT, showed that overly tight BP control in older adults increased fainting episodes and kidney issues, even when it slightly reduced strokes. What to do instead? Don't blindly chase numbers. Talk to your provider about functional goals, staying active, preventing falls, and maintaining independence. A slightly higher blood pressure isn't always dangerous in older adults. In fact, it can be protective. Section 4. Routine glucose screening when you don't have diabetes. Should you get your blood sugar tested even if you feel fine? If you're not diabetic and over 70, routine glucose testing may not be necessary, and it might actually lead to overtreatment. Here's why. Seniors often have mildly elevated sugars due to age, not disease. Once slightly high levels are found, doctors may prescribe medications that aren't needed. These medications can cause low blood sugar, fatigue, nausea, or dizziness. In some cases, simply changing your diet and staying active is far more effective than relying on pills or insulin. A 2022 article in BMJ emphasized that screening older adults without symptoms for diabetes or prediabetes rarely improves outcomes, but often leads to stress, over-medication, or misdiagnosis. What to do instead? If you're healthy and have no signs of diabetes, discuss whether routine testing is even necessary. Section 5. Polypharmacy, the hidden risk of too many medications. As we age, the pill bottles multiply. Blood pressure, sugar, cholesterol, bone density, sleep, anxiety. Before you know it, you're taking 8 or more pills a day. That's polypharmacy, and it's one of the biggest health risks for seniors. Here's the reality. Multiple medications interact with each other in unpredictable ways. They increase risk of falls, kidney damage, dementia-like symptoms, hospitalizations from side effects. A 2024 study in The Lancet Healthy Longevity revealed that seniors on 5+ medications were twice as likely to end up in the ER for drug-related complications. What to do instead? Have your medications reviewed every 6 to 12 months. Ask your doctor or pharmacist to deprescribe, safely reduce unnecessary meds. Prioritize quality of life, not quantity of prescriptions. Remember, more pills don't always mean better health. Bonus section. Screening without a purpose, a dangerous habit. You've been told, better safe than sorry. But in health, that mindset can be harmful after 70, especially with unnecessary imaging, cancer scans, or blood tests done just in case. Examples: full-body scans without symptoms, frequent colonoscopies despite clean results, repeated MRIs or CTs for vague complaints. These can lead to incidental findings, harmless issues that trigger more tests, biopsies, and anxiety, all without real benefit. Key question to ask your doctor: will this test change anything about how you treat me? If the answer is probably not, then maybe you don't need the test. Conclusion: your health, your wisdom. After 70, your health goals shift. You're no longer aiming for perfect numbers. You're aiming for stability, independence, and peace of mind. The truth is, not every checkup is helpful. Some tests and treatments, while well-intentioned, might do more harm than good. So before you agree to that next scan, pill, or lab order, pause and ask, is this necessary for me? Will it improve how I feel or function? Because the best health strategy after 70 is not aggressive, it's wise. If this video gave you something to think about, share it with a friend or family member over 70. Let's help our loved ones live not just longer, but better. Subscribe to Elderly and Wise for more no-nonsense health tips tailored for seniors. Like, comment below if you've ever experienced over-testing yourself. Get and hit the bell so you never miss a health truth no one else is telling you.